Good morning, ladies and gentlemen. I'm Arthur Brooks, President of the American Enterprise Institute, and I'm delighted to welcome you to this morning's event featuring Governor Mike Pence of Indiana. The title of his talk today is Market-Based Medicaid Reform in the Age of Obamacare. And we're looking to, with very much anticipation, to hear about his state's new waiver proposal for Obamacare and Medicaid. Mike Pence was elected as the 50th governor of the state of Indiana in 2012. Prior to that, he was Indiana's representative in the 6th Congressional District for 6 terms. In the House, he served as House Republican Conference Chairman and the Chairman of the House Republican Study Committee. He's had a huge amount of public service at the federal and state levels. He has distinguished himself in his career as being a warrior for the people, particularly the people who have less power than average. And today's policy is no exception. It's my honor to welcome Governor Mike Pence.
Thank you, Arthur. Thank you for that very kind introduction, and thank you for the hospitality of the American Enterprise Institute. I'm genuinely grateful to you and to the AEI family, not just for your hospitality today, but for really keeping the twin lights of freedom and enterprise burning brightly in a city that too often seems committed to extinguishing those lights in our nation. AEI's mission, as I see it, is about keeping the hope of opportunity, of a better life, a more vibrant society, alive and well in this country, and promoting empirically grounded, fresh ideas to make that possible. So it's an honor for me to be with you today, and please join me again in thanking the American Enterprise Institute and Arthur Brooks for your great leadership in this country. Like many of other admirers of yours and of your work here at AEI, Arthur, I have been influenced by your writings and your sense of the term earned success. And I come from a state that works. It's a state where people value hard work. And so I see the principle of really earned success lived out every day across the 92 counties of Indiana. As I travel across my home state, I see it in the school teacher who helps at-risk kids after school to help them graduate and go to college. I see it in the entrepreneurial business owner who started the business in their living room and now employs 50 people. Or the police officer who takes pride in keeping the peace in our streets each and every day. I see in cities large and small all across the state of Indiana that principle that you've articulated so well, that people are happier and more motivated when they build something of their own, when they take greater ownership in their lives and they earn the success, whatever level of success that is. And that principle is much of what brings me here today. What I'm here to talk about today is related to that point, and it concerns the future of healthcare in America, and particularly how Indiana has been leading the way for the kind of reform that I would submit respects the dignity of every person regardless of their income and honors the aspiration of every person for a better life. I agree with the thinking here at American Enterprise Institutes, and that it made the case that reform-minded conservatives need to ensure that the safety net is well designed and strong to provide a firm basis for those starting out on life's ladder. I cite none other than President Ronald Reagan, who would say in New York City in 1979 these words. President Reagan said, quote, "We have long since committed ourselves as a people to help those among us who cannot take care of themselves. But," he added, "the federal government has proven to be the costliest and most inefficient provider of such help we could possibly have." Well, I would submit once again Reagan was right. The truth is, the safety net doesn't need to be expanded, as some in this town argue incessantly. And it doesn't need to be abolished, as some also argue. It needs to be reformed. It needs to be made better. And I believe that can best happen in the laboratories of innovation and democracy at the state level. I mean, if you think about what President Reagan said so many years ago, is that we have long since committed ourselves to help people who can't help themselves, but that the federal government itself was the least suited able to do that. And I come before you today to really say that when it comes to the issue of health care, I believe that people in my party need to be solutions conservatives, offering real alternatives to the big government answers of the liberal establishment that are grounded in respect for the aspiration of every person to earn their own way, to succeed, to achieve self-sufficiency, and to do that in the best way possible, with the kind of innovation that can happen all across the country on a state-by-state level. Now, I say all of this recognizing that this is the very antithesis of the approach embodied in the Affordable Care Act. Ordering every American to buy health insurance, whether they want it or need it or not, is not the answer to expanding access to affordable health care in America. I've said it before, I'll say it again. Obamacare must be repealed. And Obamacare must be replaced with market-based reforms and, as I'll elaborate more today, with a flexible Medicaid block program that allows the states to create innovative solutions at the point of the need. I have and will continue to advocate for a Congress and a president that has the political will to repeal Obamacare so we can do even more to improve health access and outcomes. Some of you who've known me for a while in this town know I was a pretty vocal opponent of Obamacare when I was in the Congress. I said then that this law will not stand, and I believe that more today than ever before. Even though Obamacare's architects and boosters are breathing a little easier, it seems these days, the program is still terribly flawed and should be repealed. It's bad for families, it's bad for business, and it's bad for America. And despite the great progress we've been making in our economy in the state of Indiana, there's not a day goes by that I don't travel across the Hoosier State and hear people tell me that the implementation of the Affordable Care Act has a dampening effect hanging over Indiana's economy and our nation's economy. It's truly stifling growth in America. Now, early in our administration, against that backdrop, I made it clear that Indiana would not establish a state-based exchange, and I stand by that decision. Everyone knows the fiscal position of these exchanges is untenable, even if they won't admit it. And come November, when the rates rise again, I predict you'll see another big drop in public support. It was a government takeover of health care. And the overly regulated, top-down command and control structure of the law will never allow the exchanges to operate freely as they should. And as a result, access will stay the same or get worse as costs go up. I always thought that was the fundamental flaw of the argument on the other side. Most people I talked to back when I was serving in the Congress, back home, would say they were most concerned about the cost of health insurance. But the focus in the Congress wasn't on lowering the cost of health insurance, it was about growing the size of government. And that's how the Affordable Care Act came to be. Well, so Obamacare needs to be repealed for all of those good reasons. And I would submit to you for one more, because it's pushing a massive, flawed Medicaid program on the states. I believe a plan for state-based Medicaid reform is not only entirely consistent with the repeal of Obamacare, but I believe it helps make the case for why repeal is needed. Now, Republicans in Congress have long argued for reforming Medicaid into a block grant so the states have flexibility to design better programs. I can't think of a budget that I voted for during my years in Congress that didn't include block granting Medicaid back to the states. And I submit to you today that in the debate over health care reform, states need to lead the way, like Indiana's doing. Last week, I announced that the state of Indiana will seek to do just that, to seek flexibility from the federal government to close what's known as the coverage gap by expanding our own homegrown health care solution. It's known as the Healthy Indiana Plan. Now, honestly, I've been talking about using the Healthy Indiana Plan as a basis for expansion of health care coverage in Indiana since even before I took office in January of 2013. Today, I'm pleased to have the opportunity to share with each one of you the details of our administration's proposal to expand the Healthy Indiana Plan and offer consumer-driven, private market-based health care coverage to low-income Hoosiers. First, a little bit of background. Today in Indiana, we have some 350,000 low-income working Hoosiers, those below 100% of the federal poverty level. Or for a family of four, that's about $24,000 a year. These are Hoosiers who lack access to the kind of quality health insurance that many of their better-off neighbors enjoy. Experts, as I said, rightly call this the coverage gap. But truthfully, many Hoosiers up to 138% of the federal poverty level, which is about $33,000 a year in income for a family of four, also as a practical matter can't access affordable coverage, and they live with uncertainty in their families as well. Last week when we made our announcement, I had the opportunity to introduce the people of our state to a number of Hoosiers that fall into this coverage gap. Working men and women who are out rolling their sleeves up, oftentimes in the most difficult circumstances, but courageously moving forward, providing for their families. People like Becky Kincaid and Beth Murphy, proud Hoosiers all, but who find themselves, essentially for all intents and purposes, caught in that gap, where their income simply doesn't give them the ability to purchase health insurance for themselves or for their families. Now, some of our neighbors across the Midwest have chosen to address the coverage gap by expanding traditional Medicaid. And I respect the decisions that others have made. I'm here to talk about Indiana's decision. From the beginning of my tenure as governor, we've been saying no to Obamacare in Indiana. We declined a state-based exchange, and I've made it clear from the outset that we will not expand traditional Medicaid on my watch. Medicaid is not only broke, it's broken. Medicaid is not a program we need to expand. Medicaid is a program we need to reform. It was nobly created some 50 years ago to help the poor and those with disabilities access quality health care. Truth be told, Medicaid has morphed into a bureaucratic and fiscal monstrosity that does less to help low-income people than its advocates claim. And Obamacare advocates continue to promote Medicaid expansion despite the overwhelming evidence that the program doesn't work as it's supposed to. As a highly anticipated study in Oregon showed just last year, Medicaid actually increased emergency room use by enrollees and produced health outcomes that were no better than being uninsured. Other studies have also shown that health outcomes are no better and sometimes even worse for people that are covered by Medicaid compared to those with no coverage at all. I mean, the truth is, last year's Oregon study should have sent shockwaves through the ranks of public health policy experts and advocates across the country. And for some reason, it didn't do that. It should have caused people to pause and ask themselves how expanding a program that doesn't improve people's health outcomes was the right approach for America, or how it's just and fair and right to do that. I mean, if you care about low-income Americans, why in the world would you want to expand a program that provides such inadequate coverage? You know, the only thing Medicaid does well is make it onto the GAO's list of high-risk federal programs every year. I mean, we all know doctors who see Medicaid-eligible individuals for free rather than dealing with Medicaid. The program is bureaucratic, difficult, prone to fraud, and complicit in the growing disconnect between coverage and access in health care. I mean, let me say again, I think Obamacare needs to be repealed for many reasons, including that it's pushing a massive, flawed Medicaid program onto the states. Now, some proponents of expansion, particularly those who helped author that underlying legislation, the Affordable Care Act, are satisfied with covering a vulnerable population with a program that is so deeply flawed, but I'm not. Fortunately, Hoosiers have found a better way. In Indiana, we've learned that the way to change Medicaid is to base the program on what we know improves health and lowers costs, namely consumer-driven health care, using health savings accounts. Now, let me brag on the Hoosier State for just a second and tell you that we think Indiana is actually the birthplace of health savings accounts. Some of you in the policy community here in our nation's capital remember the name J. Patrick Rooney. He was an insurance executive and a visionary. In addition to his idea, which he called medical savings account, which he, perhaps more than any other American, popularized on Capitol Hill, and was able to achieve being added into the tax code as a pilot program. He also personally financed the first privately funded educational choice program in the United States of America. J. Patrick Rooney was my friend, but he was a visionary Hoosier, and we miss him. But beginning with his vision in the early 1990s, Indiana became a centerpiece for the discussion about consumer-driven health care. In fact, today, Indiana has more public employees, 96% in our state government, enrolled with health savings accounts plans, more than any other state. And our private marketplace has a higher percentage of people enrolled in consumer-driven plans compared to many other states. So the Healthy Indiana Plan, built as it is on health savings accounts and on consumer-driven health care, makes the most sense being launched and piloted and expanded in the state where consumer-driven health care in many respects was born. Now, 6 years ago, against that backdrop and that progress, Indiana became the very first state to successfully create a consumer-driven health plan to expand quality health insurance coverage to the population affected in Medicaid and covered in Medicaid. It was created on a pilot basis, and we called it, as I've mentioned, the Healthy Indiana Plan. It provides health savings accounts today to some 40,000 Hoosiers and empowers them to take ownership of their health decisions. And it works. The Healthy Indiana Plan integrated the principles of consumerism within Medicaid, encouraging enrollees to take charge of their health care, empowering them to act as consumers in the health care market. Here's some of the facts. The Healthy Indiana Plan has lowered inappropriate emergency room use by 7% compared to traditional Medicaid during the course of the program. 60% of HIP enrollees, and that's our acronym you'll get used to, 60% of HIP enrollees use preventative care, which is similar to the rates we see in general commercial marketplace. HIP enrollees choose generic drugs at a much higher rate than people covered by other private insurance plans. In fact, when you think in a very broad sense, consumer-driven health plans have been shown to decrease healthcare spending by 25% across the country. And those public employees that I mentioned in the state of Indiana, who have a 96% enrollment rate in health savings plan, that saves me about $23 million a year for taxpayers in Indiana, thanks to the adoption of those programs. We're also beginning to see this downward trend in healthcare costs within the Healthy Indiana Plan as well. And let me say, HIP enrollees also have a proven track record of managing their own healthcare decisions. 93% of HIP enrollees make contributions to their savings account on time. A third of them say they regularly ask their healthcare providers about the cost of services, and 98% say they would enroll in HIP again if they were given the choice. In a word, Indiana has proven in the last 6 years that consumer-driven healthcare works, and it works for those that are starting out on the first rung of the ladder of the American dream. Now, because of this success, last week, my administration announced plans to submit a waiver to the Center for Medicare and Medicaid Services to replace traditional Medicaid in Indiana for all able-bodied adults with an expanded version of the Healthy Indiana Plan. Now, this will go for those up to 138% of the federal poverty level, and we actually call it HIP 2.0. My kids liked that. Now, HIP 2.0 would offer three basic options, and I want to roll through them with you quickly. First would be a premium assistance plan that helps low-income working Hoosiers access employer coverage. And second, we have two health savings account-like plans with varying degrees of coverage. It's essentially a three-legged stool for health care in Indiana. We call it HIP Link, HIP Plus, and HIP Basic. Now, each of these would allow people to utilize private insurance options and consumer behavior to increase access to quality health care and to manage costs and health outcomes in the long run. First off, in HIP 2.0, we would offer HIP Link, which is a premium assistance program for people who have access to insurance through their employers today, but may simply not be able to afford it. Now, this is a defined contribution premium assistance program, and it is the first of its kind in the United States of America. Those who qualify for HIP Link, would receive a defined contribution from the state into what we call their power account. That's their health savings account, which they could use for premiums, co-payments, or deductibles. Okay, that's first. Secondly is the first of the two health savings account-like programs. HIP Plus, first and foremost, I'll say, is available to all qualified HIP members who make their contributions to their health savings account, their power account. Now, those contributions will range from $3 a month to $25 a month based on income. The HIP Plus plan offers enhanced coverage, including vision and dental, for adults, and a comprehensive prescription drug program. It also covers maternity services with no cost sharing during the duration of the pregnancy. Lastly is HIP Basic. It's something of a default plan. Now, it's exclusively for Hoosiers below 100% of the federal poverty level who fail to make their required contributions to their health savings account. Members of this plan must make co-pays. They will receive fewer benefits until they can begin to contribute to their health savings account again and move back into the HIP Plus program. Again, by way of summary, the Premium Assistance Program helps people who are employed but can't afford their employer's health plan or don't have access to a plan. The Enhanced Health Savings Account Plan, HIP Plus, provides incentives to save and use preventative care, offers a more generous set of benefits. The second Health Savings Account Plan, HIP Basic, serves as a default for those under 100% of federal poverty who fail to make their payments under HIP Plus. It contains incentives for them to re-enter the HIP Plus program. Both plans penalize inappropriate emergency room use and encourage preventative care instead. Now, contributions are required for all HIP members who choose one of the health savings accounts plans. Those above 100% of federal poverty level risk losing their coverage entirely if they do not make contributions. Those below 100% of federal poverty level, should they stop making contributions, as I said, must make co-pays, receive fewer benefits until they begin to make contributions again. The contribution amounts are reasonable and fair by income level and are designed to be that way. And as we've seen in our pilot program, let me say this emphatically. Low-income working Hoosiers in our state take pride in managing their accounts and making their contributions to their health savings accounts consistently. And we're proud of that fact. A couple other elements. The plan also includes what we call a Gateway to Work referral program that will connect those who qualify for HIP coverage with job training and job search programs offered by the state of Indiana so they can move up and out of the program. HIP 2.0 is not intended to be an entitlement. It is a safety net program that aligns incentives with human aspirations. The plan also includes high co-pays for inappropriate ER usage to encourage enrollees to use primary care rather than emergency room care to manage non-emergent health needs. And I'm very pleased to say that HIP 2.0 will be fully funded at no additional cost to Hoosier taxpayers. HIP 2.0 will be funded through a combination of federal funds and an agreement with Indiana's hospitals, who have partnered with us to improve access to health care coverage within the state of Indiana. This means, if approved by the federal government, our waiver will allow us to expand health care coverage to hundreds of thousands of Hoosiers with no new state spending and no tax increases required. Now, if I haven't thoroughly confused you, or if I have, you can go to our website and read all about HIP 2.0 to your heart's content. It's at hip.in.gov. Learn more about this program. You know, I think HIP 2.0 maintains emphasis on the principles that animate my political career, and I think are at the very heart of the people of our state and the people of this country. They put the emphasis on personal responsibility. They also represent a continuing effort in Indiana to find innovative, fiscally responsible ways to get people the care that they need. Reforming traditional Medicaid through this kind of market-based, consumer-driven approach, I believe, is essential to creating better health outcomes for the people of our state and curbing the dramatic growth in Medicaid spending for the people of our country. I truly believe that once Obamacare is repealed, that the consumer-driven plan that we're proposing in the Healthy Indiana Plan will serve as a model for what block-granted Medicaid programs could be in states across the country. With this, I'll close and be pleased to take some questions. I believe there are only two futures for health care in America today. There's government-driven health care, or there's consumer-driven health care. Years ago, when the Healthy Indiana Plan was first adopted, Indiana chose the better portion by embracing consumer-driven health care, giving eligible Hoosiers the power to make their own health care decisions. And now we're seeking permission from the federal government in the form of a waiver to build on that choice by expanding the Healthy Indiana Plan for even more working Hoosiers. HIP 2.0 takes consumer-driven Medicaid reform to the next level by replacing traditional Medicaid in Indiana for all non-disabled adults and offering instead a health care culture that is built on healthy, cost-conscious decision-making. Again, let me say, HIP 2.0 is not intended to be a long-term entitlement program. Our hope is that people will not be on it very long at all, but will transition into the private insurance marketplace. That their opportunities in taking greater ownership of their own health care will lay a foundation for good health, for prosperity in their family as they move up and out of the program and are able to obtain insurance in the marketplace. HIP 2.0 is a safety net that aligns incentives with earned success, hope, and opportunity. The truth is, the soft paternalism of the modern welfare state has failed to honor the dignity of the working poor in many ways. By failing to give them the benefit of the doubt and by failing to believe in them. In Indiana, we believe in our people, regardless of their income, regardless of where they find themselves on the path to success. And HIP 2.0 is really designed and built with that faith and that confidence in the people of Indiana and their ability to take hold of their futures if given the opportunity to prosper. Now, lastly, let me close here at this policy group and surrounded by so many think tank people. Let me ground this a little bit more in the world in which I work every day. You know, I think as we talk about policies and coverage and healthcare reform, the debates that take place on cable television and on the airwaves across the country, we must never forget that we're talking about real people, working people who deserve a better way. I mean, HIP 2.0 and our proposal to reform traditional Medicaid in Indiana is about reaching out to people that are working hard to build a better future, but simply don't have the ability, don't have the means in the health insurance economy that we have today to be able to provide coverage for themselves or for their families. But they're real Hoosiers. And I've talked to many of them across our state. since I've begun to serve as governor. And one of them, I'll close with, was named Diana. I met Diana at a visit to Community Hospital East in Indianapolis just a few weeks back. She was in with a heart condition, but she said it was okay if I came in her room anyway. She was self-conscious about how she looked, and I tried to set her at ease. I told her, "You look great," right? I sat down next to her bed. I took her by the hand, and she told me her story. Diana had lost her insurance when she lost her job. And shortly thereafter, she started having chest pains. And even though she knew she could go to the emergency room and get treatment, she waited. She actually told me, sitting up in her bed, she said, "The doctors told me I put off coming in a little too long." But she said, "I didn't want to come in because I was embarrassed because I didn't have insurance." Now, thank God she's okay. And I prayed for her more than once since that day at her bedside. But she touched my heart. I mean, here was a hard-working woman who just wanted to find a way to pay her own way and not rely on the free access of a public hospital. You know, I think Diana's like a lot of working Hoosiers. People that don't want a handout, but they need a hand up. You know, in Indiana, we've long cherished the principle that you should love your neighbor as yourself. And that we should never walk by on the opposite side of the road when someone's hurting and in need. I think it's what makes Indiana special. And let me just say, that's what HIP 2.0 is really all about. Respecting the dignity of every Hoosier, including our working poor, to find a way to cover themselves and their families, respecting their ability to make their own health care choices, and empowering them to lead healthier and better lives. I think the Healthy Indiana plan is a better way. It's a better way to better health, to better coverage, to a better healthcare system, and a better future for working people in the state of Indiana and beyond. I hope that our success with this program will help other states as well and serve as yet another reason why we should start over on healthcare reform in America, why we should repeal Obamacare and replace it with a plan that includes consumer-driven health care for low-income Americans and empowers them and their families to meet their needs and make their own way. Thank you very much. I appreciate your time and attention today. I think we've got a little time for questions. Go ahead.
My name's Dan Perrin. I'm the head of the HSA Coalition. I want to thank you, first of all, for mentioning my mentor, Pat Rooney, and his role in this. And secondly, I want to just endorse what you're doing here. I think it's incredibly innovative. I think it's incredibly courageous. You've got tremendous street cred for the 96% of state employees who are using HSAs now. In addition to that, your HIP 1 plan is the only one in the country like it. And the results are clear on their face. You know, people save money, you save money, and you bring personal responsibility and choice within a government construct under an Obama construct. And that's no small trick, so I just want to say thumbs up.
Well, thank you very much for that. I appreciate it. And And we are proud of our heritage with health savings accounts in Indiana. We really do believe it's an idea that was born in the Hoosier State. And someone asked me last week after we announced this, they said, why are you expanding the Healthy Indiana plan? And I said, because it works. I mean, sometimes, I worked in this town for about 12 years, and everybody's always got a new idea, right? This isn't a new idea. This has been in the field working for people eligible for Medicaid in Indiana. It's also working for our state employees, and that's the very core, very practical core of why we want to expand this program. Please, hi. You want a microphone real quick?
My name is Barbara Dello, and I'm a nurse, and I'm a caretaker of an elderly parent, and I want to thank you for the work you're doing on this. Does Healthy Indiana work through a combination of health savings accounts and sometimes a modified insurance? And does it have to work within the mandatory benefits package that sometimes gives too much of one kind of care and not enough of another and drives up cost?
The short answer is, and I recommend that you go, and I'll plug it for our C-SPAN audience again. It's hip.in.gov. Read all about it, but it's basically a three-legged stool. And the first piece of it, HIP Link, basically allows individuals to use what would be the state's contribution to their health savings accounts for premium assistance. If there's a lot of people in this category, and again, if you walk out of here with no other realization, this is a program that we are designing to meet the needs of working Hoosiers. Okay. These are people with jobs, and maybe they've fallen on hard times, but these are people that are working for a living or aspiring to work for a living. And so first would be the premium assistance piece allows people to purchase health insurance they might not otherwise be able to afford through their employer. And as I said, it is and this is for the technical people in the room, it's as a defined contribution premium assistance program, it's first of its kind in the country. It is in effect a voucher for people to use these public resources and go purchase their piece of their health insurance through their employer. The other two pieces, HIP Plus, is very much designed after our current Healthy Indiana plan today, and it's a true health savings accounts. There are consequences for non-payment. It's open to everybody that is eligible within the population, up to 138% of the federal poverty level. But to your last point, for people under 100% of the federal poverty level, given current federal regulations, there is a certain minimum amount of coverage that within the waiver that we have today and the waiver that we're requiring cannot be denied. But the way we've structured it is in effect by making the full health savings account plan, the HIP Plus, more attractive, eminently affordable, with better benefits. We have every confidence that people are going to choose the HIP Plus plan in increasing measure, and believe that we've created what we call a value proposition that will drive people to that outcome. But again, our waiver's been structured within existing federal law and regulations, to your point, affecting the lowest. Yes, right here. Yeah, go ahead.
Good morning, Governor, and my name is Jim Gandolfo. I'm the chairman of the HSA Council for the American Bankers Association. We
hi, Jim.
represent about 92% of every HSA in the United States, and I can tell you that the words you used here today really resonated, and it's one that I used with a Democratic senator years ago, back in '06. It was dignity, sir. And what you're doing, so I can tell you empirically, and we'd be happy to share this with anyone who is interested in hearing it or reading it, we can tell you that the outcomes that derive from ownership and dignity of ownership will drive correct choice and will, over time, teach our fellow Americans all the way across the country how to handle their health care expenses. So we endorse you. We thank you for what you're doing and congratulate Indiana. My question is, do you think there's an appetite?
Thank you, and I didn't know that when I called on you.
Is there an appetite with other Republican administrations in the states today, your fellow governors, to follow this type of example? What is your opinion on that?
Well, I'll have a better idea after this week. I'm traveling to New York from here on the train to go to the Republican Governors Association. I expect there'll be some conversation about this. So I'll defer on that second one. But thank you for your very eloquent statement about health savings accounts and their value. You know, at the core of this, the reason I'm so enthusiastic about Indiana's leadership on consumer-driven healthcare is because it's better for people's health to give people a greater opportunity to take ownership in their healthcare decisions. I mean, you know, there's that old saying that says, when you got your health, you got lots of problems. When you don't have your health, you have one problem, right? I mean, in my family, in yours, we all aspire to good health. What's great about consumer-driven healthcare, and it's yes, there are the advantages of it. It bends the cost curve. Most experts suggest that the advent of consumer-driven healthcare is what's slowing down the rate of inflation in the healthcare economy today. I get all of that. I get more excited, though, when I talk to somebody working for a small business in Indiana or in the Healthy Indiana plan today that says, my life got better because I had an incentive to take advantage of preventative medicine. I found out some things I could do in the area of smoking cessation or losing weight or all these different areas. I mean, that you know, that a lot of people that have the opportunity to avail yourself of primary care on a regular basis, go see your own doctor, you take for granted. But for people to have greater access to and have the incentive to take greater ownership in their own healthcare choices, which is the very core of that original vision for consumer-driven healthcare and health savings accounts, what I get most excited about. Yes, please. Hi.
Hi, sorry. My name is Sarah Cliff. I'm a reporter here at Vox.com. I was wondering, obviously the Obama administration is also very motivated to close this coverage gap that you talked about. Do you think this is a moment when you and your colleagues across the state, when you have more leverage to ask for some of the flexibilities, like what you're looking for in this waiver? I was wondering if you could talk a little bit about those negotiations and this particular moment when you're working towards the same goal, it seems.
Well, we haven't shaken hands on this deal yet, but I'm hopeful. What I can tell you is that right after I was elected governor, I said then that I did not believe Indiana should set up a state-based exchange, and that I ruled out an expansion of traditional Medicaid in the state of Indiana for all the reasons that I stated today, and I've stood by that decision. Early in our administration, though, we reached out to federal officials to seek to renew our existing Healthy Indiana plan. Our waiver was running out. And as I reached out to officials at Health and Human Services, and I spoke to the secretary, and our team met with them, we said we have a two-step process here. First, because the Healthy Indiana plan had been such an unambiguous success for the people of Indiana. As I said, some 40,000 Hoosiers enrolled in this today. 40,000 Hoosiers that are all Medicaid eligible, okay? That my first objective was I wanted to preserve the Healthy Indiana plan. And frankly, in the wake of the 2012 elections, there were some that speculated we wouldn't be able to do that. With traditional Medicaid expansion available, there was a lot of skepticism whether the administration would be willing to extend a waiver. But we made it very clear what our position was, and we made it very clear that if we were able to see the Healthy Indiana plan waiver renewed, that we would then be willing to continue a dialogue about using the Healthy Indiana plan and consumer-driven health care as a framework for further discussions. I must tell you that I continue to be very grateful for the good faith negotiations that took place between our administration, the administration in Washington, over the renewal of the existing Healthy Indiana plan. And we secured a one-year extension the middle of last year. Since that time, I would say we've been in continuous discussions with federal officials. And the proposal that we unveiled last week has been a result of that dialogue. Again, there is not agreement on it, but we remain hopeful that the administration will allow the state of Indiana to continue to build on the Healthy Indiana plan and to in effect build on our commitment to Medicaid reform in the state of Indiana. So that's how I would characterize the discussions, but they've been ongoing. We're in a comment period right now where we've unveiled the proposal. The law requires us to collect comments from across the state of Indiana, and then we'll be submitting the waiver formally, we think, sometime next month. And then I expect the discussions will continue there. But we believe the proposal that we unveiled last week is the right proposal for the people of Indiana. And we also believe it's a good faith proposal that I think will serve the people of our state well for many years to come. We will seek the maximum allowable time under the law, which I think is 5 years, for that waiver. But let me say, just as I close, and then we'll finish the formal program, but I can catch up with some of you afterwards if you want. I served 12 years in the Congress, and I've served the better part of a year and a half as governor. And I become more convinced every day that the cure for what ails this country is going to come more from our nation's state capitals than it ever will from our nation's capital. I mean, at the very core of this waiver request is my belief that many of the most intractable issues facing our country, including health care, can best be solved by giving the states the freedom and flexibility to design programs that can solve the challenges the people of their state are facing in those areas. And so we'll continue those discussions with federal officials. I'm hopeful that we'll be able to expand the Healthy Indiana plan in a way that will serve the people of our state. We'll close the coverage gap, but we'll do it in a way that continues to advance the principles of empowerment, personal dignity, consumer-driven health care in our state, and maybe be an example to other people around the country. Thank you all very much. I'm honored to have you with us here today.